An ischemic stroke occurs when the blood supply to an area of brain tissue is reduced, resulting in tissue hyperperfusion. There are several potential mechanisms which can result in ischemic stroke, including embolism, thrombosis, systemic hyperperfusion, and cerebral venous sinus thrombosis. First, let's quickly recap the brain anatomy and its blood supply. At a high level, the brain can be divided into cerebrum, brainstem, and cerebellum. The cerebellum is composed of outer gray matter and inner white matter. The cerebral cortex is divided into two hemispheres, that is the left hemisphere and the right hemisphere. The right hemisphere will control the muscles on the left side of the body and vice versa. Each brain hemisphere is divided into four lobes: frontal lobe, parietal lobe, temporal lobe, and occipital lobe. And each of these lobes will control specific functions. The frontal lobe is involved in personality characteristics, decision-making, and movement. It also contains Broca's area, which is associated with speech ability. The parietal lobe helps a person to identify objects and understand spatial relationships, and it's also involved in interpreting pain and touch in the body. The Wernicke's area is located in the parietal lobe, and it helps the brain to understand spoken language. The occipital lobe is involved with vision. The temporal lobe is involved in short-term memory, speech, and some degree of smell recognition. The brainstem connects the cerebrum with the spinal cord. The brainstem includes the midbrain, pons, and the medulla, and it plays a vital role in functions like heart rate, blood pressure, breathing, gastrointestinal functions, and consciousness. The cerebellum helps with the muscle coordination and balance. When it comes to the blood supply of the brain, there are two sets of blood vessels supplying blood and oxygen to the brain, that is the vertebral arteries and the carotid arteries. The anterior circulation is composed of anterior cerebral artery and the middle cerebral artery. The anterior cerebral artery supplies the medial portion of the frontal and parietal lobe. Middle cerebral artery supplies the lateral portion of the frontal, parietal, and temporal lobes. The middle cerebral artery gives off little vessels called lenticular striae arteries, and they supply the basal ganglia. The primary motor cortex is located in the medial frontal lobe. It's responsible for the voluntary movement of the skeletal muscles. The medial portion supplies the legs, and it is supplied by anterior cerebral artery. The lateral portion supplies arms and faces, and it is supplied by middle cerebral artery. The primary somatosensory cortex is located in the medial parietal lobe. In here, the medial portion receives sensations from the legs, and that is supplied by anterior cerebral artery. The lateral portion will receive sensations from the arms and face, and that is supplied by middle cerebral artery. The posterior cerebral circulation is composed of posterior cerebral artery, basilar artery and its branches, and vertebral artery and its branches. The posterior cerebral artery supplies the occipital lobes, posteromedial region of the temporal lobes, thalamus, and the midbrain. The basilar artery and its branches supply the pons and the superior and inferior aspects of the cerebellum. Vertebral arteries and its branches supply the medial medulla, lateral medulla, and the posterior inferior aspect of the cerebellum. So if there is a lesion in any of these arteries, the brain cells will likely die from ischemia. So how do we classify an ischemic stroke? The most commonly used classification system for ischemic stroke is the Bamford Classification system. This is also known as the Oxford Classification system. This system categorizes stroke based on the initial presenting symptoms and clinical signs. The easiest way to use Bamford classification is to look for the presence or absence of the four main features of stroke, such as hemiparesis, higher cortical dysfunction, hemianopia, and brainstem signs. The Bamford classification divides people with stroke into four different categories: lacuna stroke, partial anterior circulation stroke, total anterior circulation stroke, and posterior circulation stroke. A total anterior circulation stroke is a large cortical stroke which affects the areas of the brain supplied by both middle and anterior cerebral arteries. All three of the following features need to be present to diagnose a patient with total anterior circulation stroke. That is, unilateral weakness with or without sensory deficit in the face, arm, and leg, homonymous hemianopia, and higher cerebral dysfunction. If two of the above features are present, it's called a partial anterior circulation stroke, and it's a less severe form. And in here, only a part of the anterior circulation is compromised. So in total anterior circulation stroke, all three of the features will be present, whereas in partial anterior circulation stroke, only two of the above features is present. A posterior circulation syndrome involves damage to the area of the brain supplied by the posterior circulation. And one of the following features need to be present to diagnose as posterior circulation stroke. That is cranial nerve palsy and a contralateral motor or sensory deficit, bilateral motor or sensory deficit, conjugate eye movement disorder like horizontal gaze palsy, cerebellar dysfunction like vertigo, nystagmus and ataxia, and isolated homonymous hemianopia. A lacuna stroke is a subcortical stroke which occurs secondary to small vessel disease. There is no loss of higher cerebral functions in this stroke. So one of the following features needs to be present to diagnose as lacuna stroke. That is pure sensory stroke, pure motor stroke, sensory motor stroke, or ataxic hemiparesis. To diagnose and confirm the location of the ischemic stroke, we can use a non-contrast CT and MRI. A stat non-contrast CT is mandatory and should be done immediately or at least within 24 hours to exclude hemorrhagic stroke and other focal neurological lesions. We can also use angiographic studies which will show us the exact location of the blockage. When it comes to treatment, the goal is to establish the blood flow in order to salvage the ischemic penumbra and to prevent further cell injury. To salvage the ischemic penumbra, we have to prevent hypertension, hyperglycemia, pyrexia while using the clot-busting medication. A mainstream treatment is thrombolytics like tissue plasminogen activators, which is commonly known as TPA. These are used as clot-busting medication. The indications for thrombolysis are age more than 18 years, clinical diagnosis of ischemic stroke causing a measurable neurological deficit, and onset within 4.5 hours. Before administering TPA, we should also rule out the contraindications. Aspirin can also be used to prevent more clots from forming. If the medical management is unsuccessful, surgical procedures are needed to mechanically remove the thrombus. Finally, secondary prevention of stroke is very important to prevent recurrence, like smoking cessation, controlling blood pressure, and diabetes. I hope you guys learned something today. And if you did, please hit the like button and comment your ideas. And subscribe to my channel for more content like this. And as always, thank you for watching. I'll see you on the next video.